Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Greetings and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Stewart, your host, and it's great to be with you today. Today we are doing part 2 of a 3-part series with Dr. Felix Liao. Dr. Liao is a general dentist for 40 years, and for the past 25 of those 40 years, a biological whole health dentist. He practices up in the Washington, D.C. area, and Dr. Liao, it's great to have you back again.
Yes, nice to join you as always.
So last week, Dr. Liao, we talked about how important the mouth is, not only from oral health, healthy gums, healthy teeth, but it really is the gateway to whole health. And Dr. Liao has written an amazing book, his second book in really a 3-part series. It's called Early Sirens, Critical Health Warnings and Holistic Mouth Solutions. And this is a great read. If you've read his first book or not, 6 Foot Tiger, 3 Foot Cage, I would highly recommend this book, all 3 of his books, the third of which we'll talk about next week. So Dr. Liao, tell us about the mouth and how that is a gateway to the whole body.
Right. So thank you for having me again.
You bet.
The mouth is to humans what roots are to plants. Every one of us, when we were born, we couldn't hold up our heads, but we could suffer your life. And it is through repeated feedings and sleeping that we grow. So the mouth is not only gateway to whole body, it's gateway to life, period. Okay? So this relationship does not change throughout life. When you go to ICU, for example, what do they give you? They give you oxygen, and they give you an IV, one for breathing and one for digestion and necessary nutrients, and you're sleeping. This is how you recover. This is also how you grow, okay? And the mouth mediates these vital functions, and we don't see the mouth as a vital structure. For example, every major hospital center has what? A department for every part of the body, but have you ever heard of a mouth department? Have you?
No, I haven't.
No, okay? As important as this is, okay? So we're in the dawning of this new era where the mouth is gonna become literally the centerpiece for those people who want to be proactive on their whole body health. So we see, as we discussed in the previous podcasts, how an impaired mouth structure could create so many problems. Now, if you can find a mouth doctor who is trained in this line of thinking, now we can begin to talk about how to correct this thing with what we call holistic mouth solutions. That means that if you set the mouth straight structurally so that it can perform all the necessary functions that a mouth does behind the scenes, beyond just talking, eating, drinking, and socializing, okay? And if you train the mouth owner and operator on how to steer the mouth toward health, then we can have the beginning of a proactive health solution rather than a reactive disease care system. So that's what the spirit of early Sirens is about. And actually, if you could hold out the book cover, what we're finding is that all the footprints at the crime scene lead back to the perpetrator. And the perpetrator is always a structurally impaired mouse. We're seeing that time and time again. So Dr. Hal is going to be that chairside investigator, with the Sherlock Holmes hat on, and he's going to find that, there it is again. Impaired mouse structure is the root cause, at least the structural root cause, as well as the usage root cause of your problem. So I know how you're in Texas. I've been to Texas many times. And what's great about Texas is its size, right? Texas-sized meals, Texas-sized pot bellies, and double and triple. So this state has got a greater need for airway mouth doctors.
Yeah, boy,
right?
that's the truth.
Yeah.
Well, Dr. Liao, your book covers, recognizing early signs, the early sirens. What are some of? Well, let's just go through some of that you have listed in this book: teeth grinding, snoring, jaw clicking, chronic pains and fatigue. Let's start with teeth grinding, and talk a little bit about this. I think it's slide 3.
We discussed in the last podcast how our medical system, our healthcare system is reactive. Reactive to what? Symptoms that are big enough, right? So, for example, your cancer has to be big enough before it's detectable. Well, how do you become proactive about that? Nobody talks about that. And I'm not saying I'm an expert with the answer on cancer prevention. That's not the topic. But there is a way to behave with your mouth. There's a way to own and operate your mouth in such a way as to reduce your oral contribution to any symptom, be it chronic pain, inflammation, obesity, and all the other internal conditions that leads to increased cancer risk. And that includes poor sleep and poor oxygenation. So
teeth grinding, if we put that slide back up, the layperson out there is going to say teeth grinder. So grinding causes bladder urgency, morning headaches. Well, maybe morning headaches and maybe sensitive teeth, but how could tooth grinding cause all that other stuff? And you're not talking about grinding your teeth as causing those things. Grinding your teeth is a sign that there's something more serious going on that could cause those issues, correct?
Yeah. Part of the presentation. So teeth grinding is part of the presentation that you are suffering from airway obstruction as a result of having a 6-foot tiger occupying the airway inside a 3-foot cage. So the other presentations would include all the other bullets that are listed there. And I often have my patient look at this thing and they would deny, I don't grind my teeth. And I will have them say, okay, tell me how many of these other ones you have. Yeah. Oh, maybe 6 of them. Yeah.
Yeah, and they don't have to have all. These are just some, and there's probably even more than this. We're finding out new things all the time.
Yeah, yes. And so the question really then becomes, okay, you want to use your doctor to be a firefighter to put out the fire after it goes out of control? Or you want your doctor to tell you, maybe you're susceptible to one spark turning into a wildfire.
Yeah.
What would you do? And so it is in this context that early siren is written. We don't want to wait until, and if you go to slide 4, we don't want to wait until you're at the bottom of the downhill slide in the red zone where you have 1 foot in the coffin. We want to keep you in the green zone. We want to keep you in the yellow zone and the left half where you're able to respond to stress and go back to normal. But if you go on stress for a long time, you lose the ability to go back to normal. Now you're in a downhill slide. Now you try this, you try that, it doesn't get better. You go to sleep, you don't heal. You go to the dentist and you get a filling done, and suddenly the tooth is raging out of control and you need a root canal. Why? Believe me, I wrestled with this many times in my general dentistry career. I said, no, it has nothing to do with what the dentist did. It has to do with how the patient is reacting. And the answer really is that dentists, when they treat a tooth, they don't understand what state the patient is in, where they are in that downhill slide. Are they near 1 foot in the coffin stage where they're going to need serious external assist in order for their body to run its own house? Or, for example, medication, IV, ventilator, or diapers, right? I mean, why do you need diapers as an adult? I mean, I can't understand this, okay? Why are they advertising adult diapers during news hour? There must be many of them there. And I'm sorry, I am not going there for myself. I'm going to find out why it is that this muscle controlling the bladder leakage is weak.
Yeah, I don't think it was intended to be that way.
Yeah. So you can go to your doctor to be a firefighter, or you can use your doctor to be a fire preventer. And it's in this spirit that early Sirens is written. We want to ask the question, what are the clues on the early part of downhill slide that you can reverse? And one of them is teeth grinding, and the other one is mouth breathing and snoring.
Yeah, let's look at slide number 22. That's a great example right there. You've got one person that's sleeping, breathing through their nose. They don't have an impaired mouth. Then you have somebody with their mouth open, their head kicked back. Why is snoring something much more ominous than we've been led to believe over the years? In the cartoons and movies, when someone's snoring, that means they're getting really good sleep. Isn't that right?
Well, maybe and maybe not. So what we know now is that snoring is or can be a health hazard. It could be an indication that you're at risk for something. So in this study, it shows that if you are snoring more than half the time, which is 4 nights a week, you have twice the risk of getting stroke. And if you have sleep apnea and you're overweight, you have 8 times the risk of getting a stroke as a heavy snorer.
Wow.
Well, I don't know about you, but I would choose cancer over stroke. At least with cancer, I have a fighting chance. With stroke, by the way, my mom died of a massive stroke. I never got to say goodbye. And heaven forbid, if you get a stroke and you didn't die and you have paralysis, I'm sorry, you have a long and hard and maybe even potentially bankrupting road ahead. So this is nothing to kid around. This is something to take seriously. We all know too well now that if you can't breathe, you can't live. And if you have impaired breathing for any reason, then your health is going to be in the decline. And it turns out that when you're snoring, you're not breathing through your nose. And when you're not breathing through your nose, you're losing the benefit of having nitric oxide produced in your body. And nitric oxide is this magic air-like airborne messenger that informs your vascular system to relax. And this is the magic behind Viagra, and all of those erectile dysfunction pills. But this is also the secret behind some of our cases that we now have about how asthma patients, once they get their jaw redeveloped, they don't need their asthma medication nearly as much. I had a patient who didn't ever need her asthma medication in 2 years. And this is after 30 plus years of relying on her inhaler. So if you cannot breathe through your mouth, you have the mouth breathe, and there's a whole cascade of consequences that is actually easy to fix. But you have to recognize the 3-foot cage, you have to address the 6-foot tiger, and you have to address the diet. So if we were to go to slide 25, for example, at age 20, everybody has 100% of their nitric oxide level at your peak form. By the time you're 50 years old, you can either retain 80% of it or you can only have 10% of it. That just depends on your lifestyle, how you eat, exercise, and behave with your mouth, whether you end up with a pot belly and a double chin.
So nitric oxide is very important, and we only maintain a healthy supply of that or a healthy infusion of that into our air that we breathe if we're breathing through our nose and not our mouth. And if we're breathing through our nose, we don't snore. And a good friend of mine, Dr. Jerry Simmons, he's a triple board certified neurologist in Houston. He's showing studies that are correlating calcifications in the carotid arteries, these arteries that basically take blood to your brain. He's showing a correlation of calcifications that are related to snoring because of the vibrations. And so, yeah, snoring is nothing to sneeze at, pardon the pun, but it's not. It's a very serious, can be a very serious condition. And it's, again, an early siren. It's an early warning. So
yes.
If you or your spouse, your bed partner snores, if your child snores, there's something going on. Get it looked at. Jaw clicking. That's another thing. I can't tell you how many people over the years, I started treating temporomandibular joint dysfunction, 25 years ago, just, 4 or 5 years into practice. And the vast majority of people that come into my office, even back then, now they all have jaw clicking because they're coming for a specific reason. How does TMJ, as the general public calls it, TMJ, how does that relate to impaired mouth?
Great question. And so I like to use something that most people can relate to. That is a knockout punch in boxing. Where is it delivered to? It's delivered to the jaws. In boxing, there is a kill switch. Okay, that's literally called a kill switch. That's the chin point. Anytime you can land on the jaw, the mandible, you can basically buckle your opponents at the knees, drop them on. Okay, why is that? Because the jaws are richly endowed with sensors that tells you whether your head and your body is upright or not. You short circuit that, and the strongest boxer will crumple. Okay, so we know that the jaws plays a very dominant, if not the most prominent role in the brain as far as our posture is concerned. And when your jaw joints are impaired because your upper jaw failed to thrive, and I will tell you that is the most common reason. Nearly 100% of the time, I found that Liao sign indicative of failure to thrive on the upper jaw is the root cause of TMJ problems. How do I know that? We find, therefore, that if we redevelop the jaws in the maxilla with the epigenetic appliance on adults, all the TMJ problem falls away, all the neck and shoulder and back pain gets better, all the sleep gets better, and the patient come back with more energy and happier smiles. I mean, that's from the inside out. That is not a cosmetic dentistry cover-up job.
Right. That's all cosmetic dentistry does. It perhaps makes the mouth look healthier, but it's doing nothing for anything other than aesthetics.
Right.
If
It's
we
a
look
pain
at,
job. It's a pain job, but it doesn't alter the substantive cause of the jaw clicking or the neck and back pain.
and then that leads to an impaired mouth leads to basically just to chronic pain and fatigue. I know a lot of my patients over the years that I've treated that had, quote, fibromyalgia, unquote, which is a term basically just for systemic full body inflammation. Their fibromyalgia just kind of disappears.
Yep.
So chronic aches and pains, Dr. Liao, that can be tied to an impaired mouth?
Sure. I remember very clearly, I used to run track and field and I loved it. And the hardest event in track and field is 400-meter dash. I mean, you run flat out one lap around the track. And by the time you run to 300 meters, that last 100 meters, your muscles, your legs are on fire. And your whole body practically goes numb. Okay? And the winner is the one who can struggle through that. But that's on the athletic side. I mentioned that because the muscle cramps, the burns, the aches comes from excessive lactic acid. And how do you recover? You recover simply from drinking and breathing. Your mouth functions. All right? So you breathe and you give it oxygen and the muscles can recover. It's that simple. And so why do people clench their jaws and grind their teeth? It's because the body is trying to resuscitate itself. It's trying to open up your airway. So all of you do this now. Take the web of your thumb, frame it around your earlobe, such that your index finger lays on your temple and the center of your palm lays on your cheek. Do it on both sides and squeeze your teeth together. And you can feel the muscles bulge against the palm and against your fingertips, okay? These are what we call closing muscles. They close your jaws. When you squeeze them together, your throat opens up. That's so that you can swallow. So the body plays this card when it finds itself short of oxygen as a result of having a 6-foot tiger in a 3-foot cage, especially during sleep. And some people even have it so bad that during the day they have to clench their jaws in order to open up their airway to stay awake and functional. So if you do that for a long time, it'll be like running a 400-meter dash all day and all night long. And that's how you end up with sore jaws, crampy muscles, and worn out joints.
Yeah, very much. I love that little exercise. Everybody can relate to that. These are some pretty powerful muscles that we have here. So when you're clenching, you're basically opening up your airway subconsciously because your body, your brain is saying, I need more oxygen. I need more oxygen. So you're doing whatever you can do. So as dentists, as whole health dental medicine practitioners, we can help our patients with education and with different types of treatment, oral devices that can actually open up their jaws and open up their airways and create more room. But it's not a magic pill that we just say, hey, wear this and you're going to be fine. The patient has to play a part in this too, and diet plays a huge part. Talk a little bit about your bone growing diet.
Right. So when you want to grow the jawbone, the appliance provides a little stimulus, like a little nudge. So I nudge myself on the shoulder here, and my body goes in the direction of the nudge. So we use the appliance, turn the gear the width of a hair per week, and the body gets that signal and says, oh, we're supposed to stretch our ligaments. Once you stretch that ligament, you need to fill it in with something. Hopefully that's bone. All right. So this is the first time that an oral appliance, in the history of dentistry, there's been many, many kinds of oral appliances. But to my knowledge, this is the first time that a bone building diet has ever been paired with a starch driving appliance epigenetically. So we want to give the body ingredients to build bone, to widen the jaws, so that all the crowded teeth would have room to line up straight. Doesn't mean they will on their own, but we need to first make room. Then the teeth can go into place, either naturally or with an assist by dentistry.
Let's talk about some specifics. A bone building diet that powers oral appliance therapy. So if a patient's going to have one of these appliances that we use that are just magical, bone building diet's important to pair with that. Give us an example.
Right. So here I made a turkey wing soup. All right, one pair of turkey wing on sale, $3.07 in that case. Mm-hmm. And when every one of us have this example, Thanksgiving, after the turkey dinner is over, you make soup with the carcass, right?
Right.
And so when you put the turkey soup in the fridge and you take it out, it's not watery broth, it's gelatin-like, okay? That gelatin actually is a precursor. It contains precursors to ingredients that makes bones. So you just eat that. So simple, right? And not only that, so a lot of people have stuffy nose. That is the root cause of snoring. And stuffy nose is really stemming from leaky gut syndrome. Okay, those of you who are interested in nutrition, you know about leaky gut. Those of you who don't know, go ahead and Google it. Leaky gut basically means that the intestinal lining of your gut is swollen and therefore leaky. And that's the root cause of food sensitivities and allergies. And so the way to heal leaky gut, and by the way, this is the cause of a lot of autoimmune disorders, a lot of itch, a lot of fatigue, a lot of multiple chemical sensitivities, okay? So you gotta heal your leaky gut if you want any sense of wellness and energy. So bone broth will heal leaky gut. This is what's so wonderful about it. So you cannot do anything better than having bone broth. Let's just put it that way. Both in terms of growing jaws, in terms of healing inflammatory diseases, and in terms of preventing degenerative diseases. And the other aspect of bone building diet is green smoothies. This is just like making your own V8 juice with a blender at home. My favorite thing is to toss in arugula as a base. I usually throw in some tomato, celery, tomatoes, and I add half a banana for taste because I don't like bitter stuff like most people. And if you want to make it a treat for kids, add a little chocolate powder and put some raspberry in. Even kids will want seconds.
So your liquid part of that is bone broth.
Yes, so there's bone broth, and you plus the greens that provides the vitamin C and all the minerals necessary to grow the bone.
Now, is the bone broth you can buy in cartons at the grocery store, is that as effective as making your own bone broth?
I'm a fan of taking control of your health. You don't know what goes in there. Do they use filter water or do they use tap water? We don't know, right? So do they add MSG? Do they not? I mean, they call it natural flavoring, but what is it? They don't have to disclose it below 2%. So for those of you who wanting to be in total control, and I have a son who is a professional chef. I know the restaurant and the food supply trade through him. The principle of buy low, sell high tells me that if you want to control everything optimally of what goes down my gut, the best thing to do is you have to learn how to cook it yourself at home. You wouldn't trust your toothbrushing to somebody else. You shouldn't trust your home cooking to somebody else.
Good point.
This is how over here. Yeah.
And what the food we eat is the most potent drug we put in our body.
You better believe it. Yes. And our American food production has become, I'm sorry, suspect in some cases, and in other cases, downright toxic. Pink slime, ever heard of that term?
Yes.
Okay. Glyphosate, like, you spray the wheat, okay? Thyroid cancer and gluten sensitivity is going out of sight, going through the roof. Autoimmune diseases. So you have to be careful what goes into your mouth. Anything that you buy commercially at a cheap, bulk, discounted rate is not a bargain to your health. It may be a bargain to your pocketbook, but beware of the trade-off, because there's nothing more costly than having to spend a whole month in ICU to recover from some serious illness.
Absolutely. Well, Dr. Liao, how would our audience, where would they go to find these recipes or these on how to incorporate in the specifics on what they should buy and where they should go? And
okay, so thank you for asking. I have paired up with my son, who is a professional chef, and we started a new business called Cook to Thrive. We teach married mothers, busy professionals who have no time to cook and who is used to just, not knowing what for dinner, just, Google what food delivery service can bring to your house. We want you to heal your whole body health by taking control of your mouth. That means that you have to learn to cook fresh, whole food, right from your skillet down your gullet. So the website is called Cook to Thrive. Number 2, cooktothrive.me. And there's a subscription service where you get weekly, not only recipes, but you get shopping lists, and you get standardized pantry items, and there'll be audio podcasts that you can listen to and make the meals while you listen, and you can basically learn to cook in a way that will thrive your health and your families and raise beautiful kids.
That's cook2thrive.me.
Yes.
Dot
Cook,
me.
C-O.
Cook. Okay. Cook to the number 2 thrive.me.
Yes.
That's great. That I'm going to go as soon as we're done here. I'm going to go look that website up and get registered. That's wonderful.
For your patients who are too busy to do anything for themselves, this is a vital skill. If you eat takeout foods all the time, my book in slide 65 will show you all the toxins that are showing up in our food supply. For example, pick the good one. Big Chicken is written by a journalist who talked about how poultry mass production has changed how the world eats.
Yes.
In terms of massive number of chickens with antibiotics and hormones.
Yeah.
And that's all over our water supply now. So if you cook with tap water, you're just concentrating a lot of those hormonal residues and antibiotic residues in your body.
Great points today, Dr. Liao. Take control of what you put in your body. Takes a little bit of extra work, but you'll feel better, you'll live longer, you'll thrive and not just survive. The book, Early Sirens, Dr. Felix Liao. Get the book, read it, go to his website, cook2thrive, cook2thrive.me, the number 2, cook2thrive.me. Dr. Liao, thank you so much. We're looking forward to next week, our part 3 and final part of this series with you. Thank you so much for being on today.
Thank you, Hal. Appreciate it.
All right. So I'm Dr. Hal Stewart. This has been Health and Harmony Beyond the Teeth. We hope you have a wonderful day. Be safe, be healthy, and God bless.